Hey, Greg Spindler here. Welcome back. So many people come in and they ask me how I got going with having a thriving practice that I have today. Everybody has a chance to make $100,000 plus a year if they want to. Some people want a full-time practice. Some people want a part-time practice. However, for me, I need a full-time practice to be able to afford the things that I want, put away money for retirement, go on vacations and so forth. But I have to be smart about it, and so can you. 100 grand. If you want to take home 100 grand, you got to think about how much more money over 100 grand you got to get to pay for your taxes and your overhead. So I would recommend you need to work about 48 weeks a year. 4 times you're going to take a week off during the holidays because you're going to have a lot of cancellations during the holidays, I guarantee it. Springtime is a great time to renew yourself, right? Summertime is great to get out there and play in the summer, and then the fall. So 4 weeks out of the year, you're taking a full week off to renew yourself, to revive yourself, so you don't get stressed out and burned out. I want everybody to move up to 90-minute sessions. That saves you time. That saves you paperwork. So you don't have to accumulate so many times doing the soap reports and so forth like that, all that tedious stuff. Stretch your sessions to 90 minutes, and I'm going to tell you how you're going to do that in a minute. So you're going to be getting to 960 to 1,000 treatments per year, about 4 a day. Okay? Now adjust your rate in your area on how you're going to make that come out. So that could be around 125,000 total that you need to gross to make this work. Now, why do we want a 90-minute sessions? Because we're going to show muscle testing with everybody to identify a protocol or postural pattern that's within the body of your client. You're going to do that protocol, and then you're going to do muscle testing again to show the value of your work and to how that client changed from the time they walked into the door and when they're leaving, getting off out of the treatment table, out of the clinical practice. So this is critical because this is where you'll be success and you'll be the go-to person with treating with performance, athletes, back pain, lower extremity stuff, head, neck, and shoulder issues. Okay? You've got to have something concrete here to where people know you know what you're talking about. You got to quit using the thumbs. Save your hands. Use the soft, flat fist. Not a fist like so, but a soft, flat fist to where it saves your hands, keeping a nice straight wrist, but it saves your career. You want to get strong, you want to get healthy, and you want to provide outstanding service. You want to answer the phone calls. You want to be able to return phone calls fast, quickly, every day, as much as you can. Return emails as much as you can. Return texts as much as you can. Send them reminders. Check up with them, how they're doing. All that stuff matters for everything else to come into play. All right? I hope this helps. I look forward to you seeing you in class. If you want to take our workshops, I will show you what the postural patterns are, muscle testing. You need to know how to test the psoas, test the glute medius, test the TFL, test hamstrings, test the SCM. You need to know how to test that so you can show the client that they are better when they leave your practice. I hope this helps. I'll see you in class soon.